Finalists in the Going the Extra Mile. Beyond the Call of Duty. The nurses of 10 North have gone over and beyond their duty to keep the inpatient haematology ward high standards of care maintained despite extreme challenges. The patient is the centre of all care on the ward, and they should feel special and cared for as staff give their best. Nursing care is 24-hour, not just in the physical sense, but ensuring the patients know that it doesn't matter what time of the day it is, the nurses are there. Excellence in management in ophthalmology. This entry describes the extensive contribution made by Mr. Stephen Boyd, Clinical Director for Ophthalmology. His effective management skills have impacted very positively on many facets of ophthalmology services, enhancing care and access for patients and improving efficiencies. He has flair, works well with staff at all levels, and in particular is the embodiment of the Trust's aspirational model of medically led and managerially supported management structure. Our Own Superwoman. Re-employed histocompatibility and immunogenetics H&I scientist Jeannie Martin, who had previously retired in 2011, along with her team has transformed the department and enabled the kidney transplant programme to flourish. Rather than simply maintaining the service, under Jeannie's leadership and through the work of the team, the H&I laboratory have excelled. The team's main focus is to ensure that not a single patient loses the opportunity of a transplant, both now and in the future, and it's impossible to overstate the importance of her and the team on their contribution to kidney patients in Northern Ireland and to the Trust. Working together to go the extra mile. In 2015, a tenant in Fairholme was diagnosed with stage 3 lung cancer. The tenant's wishes were to remain in his own home instead of moving to nursing or hospice care, even though he was aware that staff within Fairholme were not medically trained. Staff in Fairholme were keen to learn about palliative care, so they could fulfil the wishes of the tenant they had been supporting since March 2013. Bespoke training was requested by staff and delivered by the palliative care team. When the tenant passed away in May 2016, it was peacefully in his own home, surrounded by his family and Fairholme staff.